Remember to subscribe and hit the bell icon to never miss an update from Mamily.
Who doesn't want to be a mother? And if you have missed your period and you've done the test at home, congratulations if you've seen those two pink lines. I am Dr. Anita Chaudhary and I will tell you how to manage your first trimester. Remember to visit your doctor at the earliest. Sometimes we do have a false positive pregnancy test at home. Once you go to the doctor, she will assess your signs and symptoms and maybe recommend a blood test also and confirm your pregnancy. A dating scan will also be done at the right time. Routine blood investigations will be done, which are compulsorily done for all pregnant women. So if you're going through a test, don't get worried. It is just a routine checkup. And if you have any family history of any particular disease, your doctor will take a detailed family history and your past history so that you can be managed throughout your pregnancy comfortably by the doctor. And you start building a bond as soon as you visit the doctor. So the number of times you visit, so we become very friendly with our patients. And I want you also to fall in love with your doctor. So please visit your doctor for confirmation of your pregnancy. One very important thing, please do not do any self-medication. We have relatives who are doctors. Don't do any online consultation and start some medication. Please consult a doctor physically because then she will start you with folic acid to prevent neural tube defects in your children. So it is very important to go and meet personally so that all your parameters, your blood pressure, your weight, everything will be taken care of, and no free advices. Nothing comes free in this world, and no self-medication at all. One thing which is actually becoming common in the world these days is smoking and alcohol, and also recreational drugs. There is no safe limit in pregnancy. So both the partners, the mother and the father, it is your moral duty to stop smoking if you have been doing, and no drinking, no social drinking as well, because that also impacts the baby's health. Not just the baby's health, research has proved that it affects your next 2 generations. So I'm sure you don't want your child to be affected by these things. So say no to alcohol, smoking and recreational drugs. There's no compromise on this. Most of us are addicted either to chai. Just that word, gives us that energy. And some of us are addicted to even coffee. You cannot take too much of tea or coffee either. Just 2 cups of coffee a day is enough, because caffeine and tannin also interferes with the absorption of iron. And just imagine you have 1 cup of coffee and you feel so full. It actually interferes with your healthy appetite as well. So reduce it. It will be best if you completely say no to that. Personally, I never take tea, so it is very easy for me to preach because that's exactly what I do. Most of us are animal lovers. Some of us have dogs at home, and some of us even have cats at home these days. If you are pregnant, please avoid cleaning the cat litter yourself, because by that you can have a disease called toxoplasmosis. And if there's no way out and you have to do it, remember to maintain hygiene, wear gloves, and only then clean the cat litter, because toxoplasmosis can cause a lot of complications in your pregnancy. I think most of us are foodies, and during pregnancy, girls will get so much of free advice. Eat this, don't eat that. I am a doctor, and even I remember I used to get so many free advices. You're a doctor, that is a different thing. But I am telling you, eat this and don't eat this. And so many fads and so many myths. Don't eat anything black, then your baby will be dark. It is all rubbish. What you need to do is eat healthy. That includes fruits, green leafy vegetables, different varieties of dals. Nature has produced so many varieties. Another thing that is important is eat local. Local is something grown within 200 kilometers of place where you stay. what you can digest in Kashmir, you cannot digest the same food in Kerala. That is why we have different foods in the entire country. So please remember to eat seasonal and local food. And fresh food is the best thing. Avoid packed food completely because it has lots of preservatives and we don't even know the nature of preservatives. These days certain apps are there. You can scan in the apps and know what is safe, because so many foods have actually crossed the safety limits in India. So just don't eat anything because it's going to influence your next generation. So mindful eating. What you're eating, concentrate and focus on that and eat. You're thinking of something, watching TV and eating, no. One thing at a time. So just eat the right kind of food. It is not just food to eat, food for thought also matters. That will be covered up later on. One commonest sign in the first trimester is morning sickness. And girls, believe me, it is so bad. And I can empathize with every pregnant girl because I have personally experienced that in all my 3 pregnancies. It's such a nightmare, but you can't avoid it. One good thing I always tell all my patients is, if you have nausea and vomiting, it means your baby is fine and growing up healthy. So just keep that positive thing in your mind. Every time you have nausea and you're feeling low, just remember your baby is growing. So that will actually keep you motivated to go ahead. Lots of people say have juices. I am not very fond of juices. See, if you have one orange, it will give you roughage also. But if you have to have juice, it would be like, 3 oranges and 1 glass of juice. That way your sugar levels increase rapidly. So it is better to have roughage, have a complete food and have different varieties of fruits and no fruit chart, because each fruit has different pH. So if you have a banana, after 1 hour you can have an apple, and day wise you can change your fruits as well. And it is best to have little food all day so that the digestion becomes easier. You can't have larger meals. So food is very, very important. So just to summarize, have whole fruits, have lots of green leafy vegetables, and salads are also must, and have a variety of food. That will also give you lots of nutrition, lots of multivitamins, proteins. Vegetarian food is a complete meal. What does the animals eat? Elephant only leaves. No, it doesn't get sugar canes every day. Horsepower. Horse, it eats only grass, but it's still so strong. So don't be under the impression that vegetarian diet lacks something. It's a complete meal. So just enjoy it and be happy. Constipation is another very common issue that the girls come and complain to me. What actually happens is the intestinal movements reduces because of the effect of hormones in pregnancy. So constipation is the side effect of pregnancy. When you got married, you didn't ask for side effects of getting married, or when you became pregnant, you didn't find out about side effects of getting pregnant. These are the side effects. But have a positive mindset and just move forward. So constipation, drink adequate amount of water. For every 20 kgs of your weight, drink 1 liter of water. Preferably warm water would be good, because our body will not have to put in too much of efforts to bring that water to our body temperature. So have slightly lukewarm water. And how much? For every 20 liters, every 20 kgs, 1 liter. So 40 kgs, 2 liters. And what all this will include? It will include buttermilk, rasam, all the liquid things that we have like dal or sambar, or vegetables which have lots of water content, like all the gourd families. So that will also include the watery kind of things that you're having, maybe coconut water as well. So all that put together, so for 60 kgs of weight, 3 liters. So don't overdo anything. All this will prevent you from dehydration. Some of them have too much of vomiting. They can't digest anything, not in water. That is called hyperemesis gravidarum. In those conditions, you might even need hospitalization. Now, diet and water, it will also help in preventing constipation. So constipation, drink warm water in the morning, preferably sit in Kagasana or the Indian toilet. Sit like that and sip water slowly. And girls, remember, by sitting on the ground, nothing is going to happen. Earlier, Indian toilets was the only way of, defecating. Now we have these Western commodes. So many people think that if I sit on an Indian commode or if I sit down, I'm at about, it will never happen that way. There are different reasons for miscarriages. So just squatting down and doing yoga will actually help you, in your constipation, and the digestion will be better. Whatever you have eaten, it has to go. So it is very important that it goes at the right time as well. So eat right and drink right. Another symptom that girls feel very commonly is breast tenderness. Breast changes start happening the moment you become pregnant, and they continue for 9 months because your breast will not get prepared in one day for lactation. So breast tenderness is a very natural thing. What you need to do is wear the right size of bra. I advise slightly loose, maybe the neck size. Suppose you're wearing 34B, you can go in for 34C or maybe a 36B size. So something little loose will be more comfortable for you, and the fabric also should be cotton so that you are comfortable in that. And many girls think I will not wear. No, it is important to give support to your breast, and this tenderness generally reduces after the first week of pregnancy. So just wait. Sometimes you feel so lazy and so lethargic, you don't want to do anything. The hormones are playing a role. There are so many changes happening inside. Nobody can see that, but you as a mother-to-be can feel that. So it's okay. Positive framework of mind. Every time you feel low, you just have to say, all is well, my baby is growing, my baby is good, and I'm happy. So that will take you forward. Then you might have some pains here, pains there, which is very, very natural. Please do not take any self-medication or over-the-counter drugs because each medicine has some side effect. So remember to consult your gynecologist, your obstetrician, and only then take a medicine. And those relatives ke doctor, no, not needed. So every time you have some issue, please go and consult your doctor so that they can see what exactly it is, or these are simply side effects of getting pregnant. You can control a lot of these things by simple exercises, simple yoga, to keep your mind safe and sane for all the 9 months. I think the most important thing is exercise. So exercise, yoga, meditation will take you a long way. If you are not asked a bed rest for some reason, then everybody can do walking and everybody can do yoga. Yoga doesn't mean your head down and legs up. So, but do not watch here and there. Get in touch with our experts and then follow the right kind of prenatal yoga. One more thing about pain and discomfort. So the uterus is growing, the ligaments are getting stretched. So right from the beginning, you might have that stretching kind of discomfort, dysmenorrhea, what you normally feel during your periods, you might even feel that kind of pain during your pregnancy. So nothing to panic. If you don't have any bleeding, if you don't have any profuse discharge, it is perfectly normal. And I've noticed if you complain too much, your baby will also be like that, another crying master. So stay happy so that the baby is also comfortable and happy. In pregnancy, I'm sure even you would have commented or you would have heard, oh, you look so beautiful. I think you're going to have a baby girl. You look like an ugly duckling. Maybe you might have this, that. Free comments will be there. There are few normal skin changes which nobody can prevent. You might have this butterfly melasma or cloasma. For that, remember to consult your skin specialist. Most of these pigmentations do disappear after delivery. They take time, but eventually they do disappear. Then you might have even darkening of your skin, your abdominal skin. Then one linea nigra. This is a dark black line starting from your umbilicus up to the pubic symphysis. That basically is indicating your pregnancy. That is why it has a name, linea nigra. Then changes will start happening even in your nipple, your areola. That will also become darker. Girls, don't worry. These are all temporary changes in the body. Eventually, you will come back to your normal color. Stretch marks, some girls start developing stretch marks really early. But in the second trimester, those become more prominent, and I'll tell you more about that in our another video.